Welcome back. May is Bladder Cancer Awareness Month, a time to shine a light on this often overlooked disease that affects thousands of people each year. Joining me now is Dr. Murad Abeleo, a urologist with the Palm Beach Health Network, to share the critical insights on this type of cancer. Dr. Abeleo, thank you so much for being here with us this morning. Let's jump right in. What exactly is bladder cancer?
Thank you for having me. Bladder cancer is really overlooked in the sense of it is a urothelium type of cancer that affects anything in the lining of the urinary tract, all the way from the kidney to the ureter, all the way down to the bladder, and sometimes even the urethra. It is the origin of bladder cancer is transitional cell mostly. There are other kinds of bladder cancer, but that's the most common.
And what kind of symptoms are we talking about when it comes to bladder cancer?
It's usually painless blood in the urine. Usually the patient will void and will see a lot of blood in their urine, or it's detected on microscopic blood, which is usually done annually with the primary care physician.
So if we're seeing blood in your urine, does that mean that it's already extremely advanced, or is that an early stage still to catch it in?
Microscopic blood, which only detected under the microscope, a few cells, is usually very early, and that's our number one means of starting bladder cancer screening. If it's gross hematuria, meaning you could visibly see it, usually it's a little bit of a bigger tumor. Either way, I do recommend getting it checked out and seeing a physician, getting cystoscopy done to evaluate further.
And at what age should we be doing this? And are we talking both men and women?
Men and women, anyone that has any blood in their urine, this is standard of care, actually.
Mm-hmm. And for the other testing, you were saying that would catch it early. When should we start doing that? Every year? At what age?
Usually everyone gets a urine analysis with their primary care physician annually, and there isn't really an age criteria. Bladder cancer can happen at any age, really, but it's obviously more common in older gentlemen, and in men and women that have risk factors. Smoking is number one, and use of any volatile chemicals.
So what are some of the treatment plans and treatment options out there?
Usually the patient is diagnosed after a cystoscopy that's done in office where a tumor is detected. And then we move forward to resection, which we could usually remove in the operating room, and we could remove the tumor, and then the patient goes on a surveillance protocol.
And what does a recovery like that look like?
It's usually very quick because it's a transurethral resection, meaning it's done with a scope through the urinary channel. They usually recover very quickly, 1 to 2 weeks or shorter.
Have there been any advancements when it comes to diagnosing or treatments?
In terms of detection for bladder cancer, there is now molecular testing that you could run on a urine, which can save you from a cystoscopy if it shows that your risk of bladder cancer is very low or very high, and it pushes you more towards more screening and more scopes. In terms of treatment, immunotherapy, which activates the body's natural immune systems, usually T cells, to attack the tumor, and it improves the chances of remission.
All right, Dr. Abeleo, thank you so much for coming in and talking to us about this important topic. If you would like more information or to watch this interview again, head to our website, WPBF.com.